for example, last night we got a gunshot wound.
Oh, wow.
And it was an 18-year-old male. Just jump in. You
Mhm.
will be exposed to a lot of good things, and
Mhm.
you will gain a lot of knowledge through this stuff, right?
Yeah.
And all of a sudden,
Mhm.
he coded on me. There was like there was no chest rises. He wasn't breathing. He wasn't responsive.
Attention, code trauma.
Hey everyone, welcome and thanks for tuning into Allied Health Mentors. My name's Eddie, and today I'm sitting with Pete Barroso. Pete is a phlebotomist, someone who I've worked with in the past, and we're gonna get into how we know each other. But if this is your first time tuning in, welcome to Allied Health Mentors, where we talk about allied health professions, careers, individuals. We just like to highlight what allied health professionals do in this career and how we contribute so much to the medical health field. And so Pete, thank you Pete, for being here with me. I really appreciate you taking the time. How are you feeling today?
I'm good.
You doing good?
5 hours of sleep. Can't complain.
Oh, Pete is a hardworking man. Now, like I mentioned, Pete is a phlebotomist here in the state of California. And Pete, you work for a hospital?
Correct. That's correct. In
You work
Santa Cruz, yeah.
In Santa Cruz, California.
Mhm.
And I'm in Los Angeles, California. So if you've seen this before, you might be wondering, like, how do me and Pete know each other? Well, back in 2019, I actually moved up to San Jose to take a position in a microbiology lab. And I had a great time working there, but I was looking to make a little bit extra on the side. And so I worked for a mobile phlebotomy company. Now, if you don't know what mobile phlebotomists do, they go to like either people's homes or retirement centers or what would you call them? Rehabilitation centers, right?
Assisted living
Assisted living,
facilities.
yeah. They
Yeah.
go to those places like that. And so I worked for this company, and on my first day, I met Pete. And Pete was a really, to be honest, Pete is probably the only guy that I've kept in touch with since moving back to Los Angeles from San Jose. Pete was super cool off the bat. I think we connected really quick. And Pete, at that time, correct me if I'm wrong, but that was your first phlebotomy job. Am I right?
That's correct. Yeah.
Right.
That I was getting my experience.
And before that, even before being a phlebotomist, you were an EMT.
Correct.
Right. And so when you were an EMT, were you working, where were you working? I believe SF?
In San Francisco.
San
Yeah.
Francisco? How what was that like?
Crazy.
Crazy?
Yes, full of surprises.
Were you running like 911, IFT? Like what were you doing in there?
You know what? We did 911s a lot.
Okay.
And a lot of transportation.
Okay.
So that's basically what I did.
And were you only in San Francisco, or would you ever go over the bridge over into Oakland or Berkeley or anything like that?
Well, the time that I was there, I only did San Francisco.
Oh, okay. Okay. Awesome.
Yeah.
And so that's kind of a transition from EMT to phlebotomy. How did you pick that? Why did you go from EMT to phlebotomy? Why didn't you pick like CNA or like, EKG tech, something like that?
When I was in the program, the EMT program, one of my instructors had mentioned, why don't you take a phlebotomy class? That way you can get an idea of how to even start, IVs.
Oh, okay.
Because EMT wasn't like my set career.
Right.
It was more of like the paramedic.
Oh, okay.
So I never really knew what phlebotomy was at the time. And so I took it, and it was awesome. That was it. And I ended up moving out of San Francisco.
Oh, so you used to live in San Francisco?
Yeah, I used to live in San Francisco. Awesome. Yeah, and that's why I worked there. And so when I moved down to the San Jose area, I had no clear path of where I was going. On top of that, I had sustained a back injury.
Oh, okay.
So it put me in a really bad spot physically with my job. So I had made a decision that, being an EMT was not going to be an option for me any longer.
Okay.
Or paramedic.
Right.
So I decided to go and take the phlebotomy program again.
Okay.
And I did, and that's how I landed, the gig in San Jose.
Okay. And then, so shortly after that, we met, and you were doing mobile. What did you think about mobile phlebotomy? Did you like it? Did you just kind of have to suck it up, or like what was your mind going through?
Oh man, there was like pros and cons. Like I
Yeah.
love the fact that, well, to begin with, it was my first phlebotomy job.
Right.
So I was extremely nervous to
Okay.
even, go to, I didn't get the right training, first of all. Like
Okay.
it was just super fast.
They kind of just throw you in there, huh?
Yeah, they kind of just threw you in there. For being a
Mhm.
first timer, I just kind of was kind of like, oh man, I don't know if like this is cut for me,
Okay.
and eventually, you get the hang of things and you start understanding what you learn in
Yeah.
school,
Yeah.
and you kind of put the pieces together, and I loved it, man. Honestly,
That's good.
I liked it because I worked by myself.
Yeah.
I was just alone, and even though I had like
Mhm.
just a time frame of like how fast I needed to get done.
Yeah.
I loved it. It was cool. It was a good job.
Yeah. And so what I remember from doing that job with you, we had a time to clock in, but we had a list, right? They would send us like a list of patients, and then you kind of had to set up your route, right? With the
Yeah.
different.
Yeah. So we would have a route, and they would give you the name of the facilities that you would go to. So you show up to these facilities, and they have a lab book or a lab binder.
Yeah.
And you just kind of go through the day that you're there and get all the requisitions that they have for the day, and start drawing people.
So you mentioned that you're working by yourself, but
Yep.
as you and I know now, elderly patients, especially bedbound rehabilitation patients, assisted living patients, can be very hard draws sometimes, right? That loose
Absolutely.
skin. So what would you
Yeah.
do? Like you had to get good real quick, right? Because who's your backup? What happens if you miss a patient?
There is no backup.
Yeah.
So you just kind of have to, like MacGyver it. You have to learn
Okay.
new tricks to go,
Yeah, no.
loose skin, dry skin,
Yeah.
definitely, veins move as
Yeah.
as as a phlebotomist.
They have a mind of their own sometimes.
Right. So
Just-
you just kind of, with all of that, you learn your own technique, and you learn quick, and you get the hang of it. I mean, you're always going to have a hard job no matter what,
Right.
eventually, but it's just it's what happens in the field.
Definitely. And something that I tell people getting in this field and that are struggling with hard sticks, I always tell them, don't be afraid to miss, right? Because I think you can agree that if you go into a room and you see a patient and you're like, oh man, they look hard, right? Or like you already go with that preconceived notion that you're going to miss, you're going to miss, right? So
Absolutely.
you have to go in there with straight confidence, right?
Absolutely. Yeah. And it's okay to miss. It's totally fine to miss, like even people that have been doing it for so long, they miss.
Yeah.
No one's perfect. So, it's what happens.
And eventually you get comfortable and then you start missing less and less. And before you know it, you're a pro like Pete. And then you get through your route in like 30 minutes and you get to go home early, right? That's how it works.
Right. That's absolutely right. Yeah, absolutely.
So Pete, how long did you do that mobile gig for?
I did it just shy of a year. I was like
okay.
a month away from a year. Yeah.
Awesome. And then from there, you're at the place where you're at now. You're in a hospital.
Correct. That's right.
We were just talking about this before we started recording, but you started in February 2020.
19.
No, I'm sorry, 2019. 20.
That's
oh yeah,
correct.
COVID-19, right? No, 20 was it?
No,
2020.
2020. No, yeah, you're right. You're right.
2020.
2020.
I know what I'm talking about. I did my prep work. So you did it 2020. That is just before COVID really everything shut down in March. So you were working in this hospital in February. Were you guys hearing anything about COVID in February, or was it not till March?
So when I started, there was just, talk, rumors
Whispers,
about, exactly, about this virus that happened in China.
Okay.
And
I remember that.
It didn't really hit home until March, as we all know, and it definitely caught us by surprise for sure.
When you heard that there was like this virus going around, what did you feel? Were you nervous? Were you like, maybe I should go do something else?
Oh man, you know what? I didn't even think I never really expected to start a new job
Uh-huh.
the beginning of a pandemic.
Yeah.
So it's a new thing for me, and I'm sure for a lot of people out there in the medical field. I didn't know what to think of it, man. I genuinely didn't know how to process it.
And when you were an EMT, did you guys ever have to deal with any type of like pandemic related things? I mean, maybe like tuberculosis is something you come across a lot in a metropolitan city, but like how do you
Yeah,
remember
I
ever
mean,
seeing anything like this?
we would definitely deal with that kind of stuff, tuberculosis, but it wasn't like on the daily. It was like
Yeah,
every
yeah.
once in a while, and you obviously you wear your PPE as you're trained to do so, but nothing compared to this pandemic. Absolutely
Yeah.
not.
And so working in this hospital now, I'm sure things switched very quickly. The PPE that you guys are using N95s? Do you have a PAPR that, with the fan? Like, what are you using right now?
Right. So yes, so in the very beginning, I'm sure just like everywhere else in the world, we really didn't know how to handle this pandemic.
Yeah.
So we started off with like your basic PPE, the gowns, the gloves, N95 masks.
Okay.
We did have capper masks,
Yeah.
but the only problem with that was we didn't have enough of it.
Oh.
So only certain nurses were able to use those.
Okay.
And as as time, or the pandemic progressed, we were able to acquire more. So
Awesome.
now I use a capper pretty much an 8-hour shift.
Okay. And how do you like that? Is it better? Well, so the PAPR, you're not wearing an N95, right? Not
No,
with the PAPR. So it
no.
must be a little bit better because you have the fan going in your face. You don't have this thing on your face, right?
Right. I like it
Uh-huh.
in that sense because I don't have to wear my N95 mask.
Mhm.
I dislike it because it's kind of like a heavy thing to wear for 8 hours.
Yeah.
But I prefer it for sure.
Okay. Awesome. And when we met, Pete, you had a full beard going on. I see you rocking the goatee. Is that
Yeah,
because of this? Is that because of the pandemic?
absolutely. I had to. So we all got fitted for N95 masks. So my beard didn't have a full seal with the mask. So
Yeah.
I had to make the sacrifice and get
shave it off.
myself a goatee and shave
Oh
it
man,
off.
you didn't want to
Yeah.
go clean. You need the facial
You-
hair, right?
To be honest with you, I look very creepy without facial hair.
That's funny. You partly inspire this little peach fuzz that I got going. I'm trying to grow a little bit of the beard, and it's because I follow you on Instagram and I see your posts and I see you with this manly facial hair, and I'm like, man, I want to look like Pete. Like, I want to look cool like that. Walk around with my stash. I'm trying.
Man.
I don't have to wear an N95 right now, so it's nice.
Okay.
So I don't have to
Nice.
keep clean, but.
So take it from me, it's a lot of maintenance.
Is it?
It
the
is.
the goatee?
It is. The goatee and the shaving. I've never shaved so much in my life. Let's just put it that way.
That's funny. You're telling me, man. I just started shaving my head. I've never used so much shaving cream in my life. It's crazy.
Oh man.
Be happy you have your hairline. Be happy you have it. All right, cool. So you're working in this hospital. So what's it like? Is it are you working inpatient? Like, is there an outpatient? Like, do people come and they sit in your draw chair? Are you working in the lab downstairs? What's that like for you? What are you doing?
So I do everything.
Awesome.
When I first started working at this hospital, we did have an outpatient in the hospital.
Okay.
Due to COVID, we had to close that because
Right.
we
Okay.
don't have we don't allow people to come into the hospital for obvious purposes.
Right.
So what we ended up doing is we have a outpatient lab outside of the hospital where people go get their blood drawn. On rare occasions, I go do that.
Okay.
Mostly, I do everything from specimen processing, microbiology, and I do my draws.
Okay. So when you started this job, did you think like, all right, I'm going to go in there and draw some blood? And then were you pleasantly surprised to see that you get to expose to this whole different field of microbiology and working in the lab? Is that something you like to do?
I love it. It's awesome.
Okay.
I never pictured myself having this door open for me.
Right.
To me, phlebotomy was just, draw blood, and that was it. but I'm very fortunate to be able to learn all of this.
Yeah.
And I really like it. I enjoy it for sure.
That's awesome. And I think I try to explain that to people all the time because they think like, oh, I'm just going to draw blood. And they think like they can only apply for places that get blood drawn. But what they don't realize is that your job title most of the time is a lab assistant, right? Is that yours or you?
Correct. That's
right?
Absolutely right.
So because your classification is a lab assistant, you're trained to work in microbiology with the CLSs, with the MLTs, receive specimens, aliquot, specimen process, and things like that. So I think it's awesome that you get that experience. And now a little while ago, you said that you were planning to go paramedic, and then you sustained an injury. Now that you're here in the lab and you've witnessed all this, do you have any plans to maybe go MLT or CLS? Does any of that interest you, or what are your future plans for the lab?
I don't know what the future holds for me.
Okay.
Because I am exposed to a lot of options in the hospital.
Okay.
Right now, I'm kind of just trying to get as much knowledge as I can from the lab. And I don't know, I would love to, get into, nursing school.
Okay.
I really awesome. enjoy the registered nurses in the ER.
Okay,
definitely. I like the excitement, the pressure.
Yeah.
As you guys know, emergency room, you deal with everything. It's always a box of surprises.
I'm glad you brought that up, because I think no matter what route you take in the allied health field, right? Whether you're an EMT or EKG tech or a CNA or a phlebotomist, you get exposed to all these career fields. And then from there, you can kind of pick and choose and say, all right, I like to do that. I don't want to do that. And phlebotomy is very unique because you're not only going to the lab, but you're also going upstairs. So you work with nurses, but you work with CLSs. And I think, like you said earlier, unless you work in the lab, you don't know what a CLS is. You don't know what an MLT is. You don't know what specimen processing is, right? So you have this unique opportunity. And then another thing you're talking about is emergency rooms. So do you guys get traumas at your ER?
Absolutely. Yes.
That's awesome.
It is awesome.
I miss traumas. I used to work at a trauma center too. Can you kind of tell me what your role is when a trauma rolls into the trauma bay?
Yeah. So, my job is to, as soon as the patient arrives, I am in charge of getting all the labs. Mm-hmm. In trauma, I have to get a set of cultures.
Okay.
I have to get a type and screen. Yeah. And then I have to get the obvious rainbow.
Right.
Once I'm done getting all my stuff, that's the main priority because we need to get a baseline for the patient that came in.
And then, okay, so the blood cultures you're talking about, is that something because of COVID or is that before COVID too?
No, that's before COVID. It's policy.
Okay, so interesting.
Every patient that we have as a trauma or even as a code, we are required to get a set of cultures. And
that makes sense because, sepsis is something that's super serious. People can turn really quick when they're septic. And so that's awesome. But when I worked in a trauma center, it was just, type and screen and the rainbow. It was like alcohol level, PTINR, all that good stuff. But we didn't have to do, the blood culture. So that's interesting. I'm glad you brought that up. So are you always sticking the patient or are you waiting for the nurse to get an IV and then pull blood for you? How does that work?
So, it depends on the situation, really. Sometimes, you get a code STEMI. Number one thing is, CT right away for the patient. Right. So I don't sometimes get the chance to get my rainbow. Yeah. So by the time they get back, there's a line. Yeah. And so nurses are actually super helpful sometimes and they'll just get the lab for us. Yeah. But sometimes that's not the case. So I get the chance to, kind of poke them and get what I need to do for the patient.
Awesome. And so let me ask you, being a former 911 EMT and now looking at traumas, where did you feel more pressure, out in the field or here with the line of technicians behind you waiting for you to get that blood? Where do you feel it?
Oh man, out in the field.
Out in the field? Okay.
Oh yeah. I mean, you are way more responsible. You have way more responsibility
Yeah,
out there than you do in the hospital,
that's true.
you know?
Yeah.
So you kind of have like a plan B. And that
Okay.
plan B is the nurses can get it,
Yeah.
but sometimes you just can't rely on that. You have to do your job. You have to do your part because
Mhm.
I've realized working in a hospital,
Mhm.
whether you're a lab tech, EKG tech,
Hmm.
a nurse, we all have to work together, and we all
Definitely.
have a role to play to, have the patient taken care of as soon as possible.
Awesome. Um, those traumas, do they? So when I worked in the trauma center, I think in the beginning it was very like eye-opening and interesting, right? It was interesting to see, but after a while, I feel like it kind of wore on me because it almost felt like desensitized, right? So like the first time I saw like a gunshot victim or a stabbing victim, I was like, whoa, right? Like that's crazy. But then after a while, it was like, oh, someone got shot, or oh, someone got stabbed, or oh, auto versus ped. Do you feel, is that
Right.
something that you felt too, that like after a while, it's almost like it becomes routine? How do you deal with that?
So, I mean, for me, obviously, it started when I worked in San Francisco.
Mm-hmm.
To me, it was eye-opening. You just never know what calls would come in.
Mm-hmm.
I really got desensitized right away.
Yeah.
Coming into the hospital setting, it was like you said, just oh, this happened,
Yeah.
which is really sad.
Yeah, I didn't know it is.
Personally, it's
It
really
is.
sad, but I think you kind of have to do that to
Yeah.
protect
To
yourself
function.
and to function. Correct.
Mm-hmm.
So, with this pandemic,
Mm-hmm.
especially, there's a lot more pressure, a lot
Mm-hmm.
more worrying,
Mm-hmm.
because in my opinion, you just don't know like how you're going to react if you do get COVID.
Yeah.
It's like kind of Russian roulette. You don't know what the symptoms are going to be and how bad they are. So
Yeah.
it definitely is a bit stressful.
Definitely. Those traumas that you're experiencing and that you're seeing, is there one that stuck with you, or is there one that maybe you can share a little bit about, like something that you've seen?
Yeah, I mean, for example, last night we got a gunshot wound,
Oh wow.
and it was an 18-year-old male.
Oh,
Um,
that sucks.
he he was just doing his thing, walking in town, and
Yeah.
something just happened, and he ended up in the trauma room
And this is
with a
in
gunshot.
Santa
This is
Cruz.
it's in Santa Cruz, yeah.
When I think of Santa Cruz, I don't think about things like that happening. Does that is that
No.
that happens in Santa Cruz?
Apparently, I've never lived in Santa Cruz. I only
Mm-hmm.
work in Santa Cruz, but it's not very often that we get gunshot wound victims.
Yeah.
It's mostly accidents,
Mm-hmm.
obviously, or
It's dark around there. It gets really dark at night.
it gets really
Yeah.
dark. Yeah.
Yeah.
We do have pedestrians walking, crossing the street, and getting hit by cars
Yeah.
a lot. So
Interesting. And
yeah.
so when you're assigned and like when you get to work, do they tell you, hey Pete, you're going to ER, or hey Pete, you're going upstairs to draw, or like do you just run down when there's a code trauma? How's your
No. So you start your shift, and
Mhm.
we have the daily schedule.
Mhm.
So everyone gets assigned a floor.
Mhm.
The hospital I work at is a two-story hospital.
Okay.
Downstairs we have the ICU, we have short stay, we have the NICU,
Mhm.
we have L&D.
Okay.
So depending on what you get, I mean, you just don't know, so you
Mhm.
get scheduled a floor.
Mhm.
Most of the time I get either the ER or upstairs.
It's because
Upstairs is, yeah, it gets pretty crazy.
I was
So
gonna
it's
say
always busy.
that's because you're the man to handle it. They probably know like Pete's gonna get the job done. Like that dude's seen some stuff. He can go deal with ER. Like he's
Right,
got it.
right.
Nice.
Yeah.
Go ahead.
I wanted to say, I saw one of your videos.
Uh-huh.
You were talking about you saved a man's life. You
Oh,
performed
the
CPR.
from CPR. Yeah. Yeah.
Yeah, I was really, that really resonated with me.
Awesome.
Because you just never know. You never know what you're gonna get. And recently, I had the same situation.
Really? In the hospital or?
In the hospital.
Tell
Yeah.
us that story. I want to hear it. I'm all ears.
So I went into this room to draw a routine troponin.
Okay. Yeah.
And if you guys don't know what a troponin is, it's a heart enzyme.
There you go.
I'm trying to, draw my blood, and my patient kind of started like snoring a little bit. And then there was these long pauses. So my brain is kind of wired to kind of see all this stuff, right?
Yeah.
And all of a sudden, he coded on me. There was like there was no chest rises. He wasn't breathing. He wasn't responsive. I rubbed his chest and I called him by his name. No response whatsoever.
Yeah.
So in our hospitals, we have a button behind their bed.
Yeah.
For a code. So rapid response team shows up as fast as they can to start, CPR, whatever they needed to do to stabilize, the patient. Well, I was by myself.
Oh.
And so I pushed the button and I was upstairs in the very far back of the hospital.
Ooh.
And
what time was it?
My chest compression. This was probably, I would say like 9:00 at night.
Okay.
And I started my chest compressions, and the nurses started coming in. Usually, in my hospital, we as lab technicians don't have the ability or the responsibility, I should say, to perform CPR.
Right.
But when there's no one around, patient is first, and you got to do what you need to do.
Yeah.
So I started my chest compressions. Nurses came in. I kept doing it for probably a good 10 minutes.
Wow.
And finally, rapid response team showed up. They, intubated him. We ended up getting a pulse for sure.
Awesome.
Which was
That's
really,
great.
It was a good news. I had not done CPR
in so long.
Yeah, exactly. And so I didn't realize the difficulty it is after, the adrenaline started wearing out and,
your palms sore? Your palms are sore?
Yep. Stomach and back for sure.
Oh man. Yeah. You just jump. It's that adrenaline rush, right? Like you said, you put, you're not thinking like, oh man, I have this former back injury. Like I probably shouldn't, strain it right now. No, you're in there and you're like, this patient just coded. Wow. In your hospital, do you have to have a BLS cert to work?
You do.
Yeah.
But like I said, it's not in our scope of practice.
Yeah, you usually don't come across that.
Right. So, I mean, we work at a hospital, there's always some sort of nurse at all times in nearby rooms. So fortunate for me, there was nobody at that time. So
how long did it take for a nurse to get in there?
I would say within like a minute or two.
Oh, okay. And then rapid response came later.
And then rapid response came within like 3 to 4 minutes.
Okay.
Because they are downstairs.
Yeah.
So, but yeah, I usually, rapid response team arrives and they take over. But because for whatever the reason, to be honest with you, I was just so focused on, doing my chest compressions.
Yeah.
I did not pay attention to my surroundings, and they were doing what they needed to do. Until they told me to back off, and because we ended up getting a pulse.
Awesome.
So,
yeah, and I think that's, and like you probably know too, but once you get on scene and someone's performing CPR, it's like paramedics, right? They never run to a scene, they walk to a scene, right? You walk because you want to keep everything, scene safety, you want to make sure everything's good around you. And then if someone's already doing compressions, okay, good, let's get the monitor up, let's get an IV, let's do all these other things to support. And then at any point you could have said, I'm tired, and it would have been no problem. Someone would have jumped in there with you. Right.
Right. Absolutely.
And that just shows how greatly trained that team is of nurses. And, I'm sure a doctor and probably RTs came by, all those people.
Yep. Everyone.
Just to back up on your story a little bit, you said he started coding. So were you looking at his monitor? Was it like his pulse ox going down? What did you see that you're like, I need to do compressions right now?
Well, so like I said, he stopped breathing completely.
Just completely.
Yeah,
went
like I
quiet.
said, he started like snorting a little bit,
Uh-huh.
and there was like pauses in between, and then the pauses were just getting longer and longer, and to
Uh-huh.
the point where there was no breathing. And yes,
Interesting.
obviously he was connected to his monitor, and
Uh-huh.
I saw, and that's when I just took over.
That's awesome. And I think it's crazy. Things can be very serendipitous, right? Like
Yep.
things happen for a reason. Because what if it was another phlebotomist that was just starting out, or someone who didn't have the prior knowledge that you had, right? And you went in there, drew the blood, and you didn't recognize the signs. But for some reason in the universe, whatever you believe in, like I feel like it was probably a good reason that you were there, right?
Yeah.
Isn't that crazy how that works?
I'm a firm believer for sure. Yep.
Wow.
Yeah, you're absolutely right.
Did you get an update on that patient later on? How did he do? Did you see him the next day?
So that same night, he ended up getting transported to ICU.
Okay.
Downstairs. And unfortunately, due to his his other health issues, he did not make it.
Okay.
Yeah.
No. And that, and if you were already drawing a troponin on him, whatever he was in there for was already cardiac related. And so this might have just exasperated it, sometimes, and who knows, sometimes people have DNRs, or maybe the family was like, if he goes through this again, we don't want to revive him. Wow. Well, I applaud you for doing that, Pete, because, I can tell you there's a lot of phlebotomists out there that, go in, stick, don't even pay attention to the patient. They're just like, give me your arm, do their thing, and they get out. Right. But like you said, it can happen at any time, I've only had to do CPR that one time, but I can tell you I've had like 10 people faint on me within the last year. Right. And so fainting's kind of a similar thing where if you're not paying attention to your patient or you're not keeping an eye on them, like they're just going to fall on their face and you're not going to catch it. But a good phlebotomist is going to keep an eye on their patient, pay attention to their breathing, talk to them so that they can see the signs and catch it. That's awesome.
Right, absolutely.
Wow, that's great. Thank you for sharing that story. I wasn't expecting that. I haven't met another phlebotomist that's done CPR. You're the first, so that's great. That's awesome. So, me and Pete had some technical difficulties there. Technical difficulties, but we're back. All right. So Pete, you just told us that crazy story. Really appreciate it. Now I wanted to kind of get more into like what you're doing in microbiology, or what are you doing like downstairs when you're in that lab?
So right now I am still training.
Okay.
But I do blood cultures. I do urine cultures, sputum cultures, Varigine, slides. Yeah. All of that.
So blood cultures, are you like putting them in the cabinet, or is it cabinet? Is that what they call it? The incubator. I'm sorry. Are you doing them?
Yeah. So when we when we collect blood cultures or when you're in specimen processing, we receive them and put them in the I don't even remember what it's called, but it's an incubator. Yeah, for sure.
Okay.
And so they stay there. The machine will detect if it's a positive result.
Okay.
And so my job is to pull it out, take it to microbiology, and do a slide along with plating. So I get my petri dishes and I spread colonies. Okay. To make sure that the bacteria grows and whatnot.
Awesome. And sputum. Do you like sputum? Sputum's kind of nasty, isn't it?
No, it's horrible.
It's terrible, right?
It's very terrible. I think you might have seen my video.
I did
on Instagram, and that came from a patient's lungs.
Ooh.
COVID positive.
Okay.
So very bad shape. So I had to do that. Yeah.
Ooh, that's fun. Yeah. That sounds like fun. I remember dealing with that stuff when I was in San Jose. I was working in the county's microbiology lab, and so just before I left, they were teaching me how to do O and Ps. So the ovum parasites, they were teaching me how to plate those and like put them in acetone and stuff. And that I did not like because I had to open up the poop, right? And like I didn't have to do anything
Yeah.
with sputum, but yeah, I remember, it was pretty gross.
I haven't done anything with poop yet.
Yeah,
But sputum is definitely not a pretty sight.
it's not glorious. There's no glory in
No,
sputum.
no, not at all.
To be honest, like I think being a respiratory therapist would be really cool, but what kind of holds me back from becoming a respiratory therapist is the sputum. I think about the
Yep.
sputum and I'm like, I don't know if I want to suck people's, trachs all day and
Yeah.
I don't know if I
Yeah,
can do that.
it's definitely not. I mean, I'm sure like anything else, you might be able to get used to it, but
get
just
used
the
to it.
fact that like,
Yeah.
yeah, it's not pleasant.
Okay. So Pete, you also mentioned to me that you're also working at a nearby hospital, that you took another job at a nearby hospital. Did you just kind of apply to that hospital? Did you know someone? Because the lab's very small. So like in my world, a lot of my coworkers work in two places and we all know the same people. It's a very small world. Are you experiencing that over there or not really?
Absolutely.
Yeah.
Yes. So to begin with, I have not started yet.
Oh, you're going to start. Okay.
I'm in the beginning process of starting,
Okay.
but I do know people there. I did my externship there.
Okay.
So I kind of was kind of memorable in a way
Yeah.
because they were constantly asking about me.
Okay.
So I ended up applying, and
That's nice.
after a whole year, they called me.
And sometimes you need that experience, right? Like I always tell
Yeah.
people, once you get that year of experience, everyone's going to call you. Everyone's going to want you.
Yeah.
It's so
Yeah.
hard to make that breakthrough sometimes.
Right. Yeah.
Do you have any advice for people applying to phlebotomy jobs, like either right out of school or after that experience? What advice do you give?
I think the best advice that I can give is,
Mhm.
you gotta start at the bottom. It takes a little longer, but if you put in the work, that whole year of experience goes a long way. You become an asset to phlebotomy.
Yeah.
So, yeah, just do what you can to start, and wherever you decide to go, that is definitely going to be a very huge help for you.
Definitely. And so Pete, like we've talked about a couple of times, you're kind of thrown off the track of what you originally planned to do. Now you're in phlebotomy. What advice do you give to other people out there who, went in with a plan and then had to divert from their plan? I'm sure at the time you were feeling, kind of down about switching course. So how did you come through that? How did you come out on top and, end up being successful in what you're doing now?
That's a hard question to answer. I don't really know. I've always known being in healthcare was for me. I like to take care of people. Yeah, I went through some dark times with my back injury, and unfortunately, I could not proceed originally what I wanted. And I just, taking the program for phlebotomy really kind of gave me a different experience in the sense that in EMT, you are more, you have more responsibility, but you are set to do everything as fast as you can to get this patient to the hospital. And then once you arrive at the hospital, our responsibilities are there. You don't really have time to conversate with the patient at all,
Okay.
most of the time.
Yeah.
Whereas in phlebotomy, you actually kind of get to know somebody a little bit of on a personal level.
Yeah.
And I kind of really fell in love with that.
Awesome.
And so that's what led me to where I am now.
And that's why you want to do nursing, because you find, if I'm right, because you find that connection with the patients and the coworkers.
Right. Absolutely. Yeah.
Awesome. And especially when you're drawing patients, at 5 a.m. and then at noon and then in the evening, I'm sure you have to build a rapport, because if not, they're not going to like you very much, right? You got to make it a pleasant experience. That's
Absolutely.
Awesome.
Yeah.
Awesome. All right. I think I'm almost out of questions. I think I got stumped there a little bit. Just, it's been an awesome interview. You've given a lot of great information. I'm happy that we were able to share your story from, the CPR to, what you went through, to your past EMT experience and how that's helped you now. Do you have any ending remarks for people who are on the fence about getting into healthcare, especially in a time when it's so scary like COVID? Do you have anything to kind of encourage them?
The best thing I could say to people out there that are considering going into healthcare is just jump in. You will be exposed to a lot of good things, and you will gain a lot of knowledge through it, and that will help you decide for sure like what path to take.
Definitely. Awesome. Pete, before I let you go, I was going to ask, you just took a trip, right? I know you're a big wilderness guy. We had talked about it a few times. Where did you go on your last trip? What was that like?
So, well, due to COVID,
Okay.
we're very limited.
Wow.
So because I lived in San Francisco for a really long time, I never really had the chance to go to Muir Woods, which is just, across the Golden Gate Bridge.
Yeah.
Very awesome. If you ever decide to come up to the north of Northern California, I highly recommend it. Absolutely. There's a lot of green. Definitely. If you like to hike in wet weather, that's totally awesome for you. I use the outdoors as therapy sometimes, so awesome. It's very helpful.
That's great. I think one time I just because on a weekend we took a drive. Whatever, I forget the highway that goes through from San Jose. Is it the 85? Goes San Jose up to Oakland, past Oakland, and then comes across where the prison is. Is that
I think that might be like 880.
Maybe it might be the 880. But it goes across the not the San Francisco Bridge, but the other bridge, not the Bay Bridge. There's one after that, isn't there? Something like that.
There's like a lot of.
Is it Folsom Prison? No, it's not Folsom Prison.
It's the
Pelican Bay. No. It's
not Pelican Bay, but it is. I just can't
San
think
Quentin.
of
Isn't
San
it San
Quentin?
Quentin? Okay.
San Quentin.
Yeah, so I went up there, took a drive, went around across the bridge towards San Quentin. And is that where Muir Woods is back there?
It's a little bit south of that.
Okay, because then you can come back down.
Right. If you were to drive on the Golden Gate Bridge, it's probably another like 20 minutes.
Yeah.
Off of the highway.
And there's like a bunch of little forts, right? Some old like battery.
Yeah.
Right?
Yeah. There's a lot of cool stuff out there. Old military bunkers and whatnot.
Hey, well, if you guys ever need a tour guide in San Francisco or Santa Cruz, I'm sure Mr. Pete will be more than happy to take you out there. Pete, I really appreciate it again. Thank you for taking the time. Thank you for being out there on the front lines, saving lives, dealing with those traumas and the COVID, and still coming out on top and wanting to do more and to go into nursing. If I'm ever in a hospital, I hope you're my nurse or you're my phlebotomist. I'm going to make sure I'm going to go to Santa Cruz just so I can get your patient care.
Awesome, man.
Whether I'm sick or not.
Good. Sounds good.
Pete, if people want to find you or follow you, do you want people to find you or follow you? Do you want to put your Instagram handle? You don't have to.
I'm on Instagram, Petasaurus.
Okay.
Find me.
Awesome.
I'm there.
I'm going to put your handle.
Questions? Yeah. If you have any questions, I'm here to help. Obviously, you guys have a great source there. So.
Hey. Well, Pete's been 100% helpful for me when I was in San Jose, and even now back home, he's teaching me a lot. I'm sure he'll be able to help you guys if you have any questions. But if he doesn't, leave him alone because he's probably saving lives and he's probably, drawing blood cultures somewhere, dealing with the trauma. So Pete, thank you very much. A round of applause.
Thank you.
Thank you, sir. I really appreciate it.
Awesome.
So that's it.
Awesome. Thanks.
This is Allied Health Mentors. We talk about allied health professionals, careers, give you guys the knowledge so you can make the best decisions on your path into the healthcare field. Thank you, everyone, and have a good day. Thanks.